brilliant slides.
Maybe Esther, you would like to try your screen share now? Would you like to try, or you're okay with it? We already given you a screen share.
To try should be okay.
Yes,
should be all right.
Yes, Shankar, our screen share kuduthunga.
Yes, sir. So streaming started, sir.
Yeah, sure. Go ahead. Would you like to try the screen share?
Yes, sir, ma'am. You can try now.
You can try now.
Can share. You want me to share screen?
Yes, please. You can try it out your thing so that you don't get. Yeah, perfect, madam.
Can see.
Yeah.
Yeah,
okay.
there you go.
You can close it now, and we are ready to go.
Okay.
You can close the screen, madam.
And share.
Yeah, you can close it actually.
You can close
come back
it.
again.
We'll come back to you, madam. You can stop screen sharing.
Yeah, stop screen sharing.
Stop screen share. Is it?
Yeah,
there you go.
Perfect. Ravi, ready to go? Let's go.
Ready, sir. Let's go.
Very good evening, ladies and gentlemen. Once again, very warm welcome to all your viewers watching this program live on our social media portals, including those who are watching the program Zoom from all over the world. Very warm welcome to you. I also welcome personally the people who have joined us on YouTube, Facebook, Twitter, LinkedIn. And it's again interesting event. I take another 1 or 2 minutes to briefly tell you what's happening in MMA so that if you have missed this mail in your inbox, so then you don't miss any of the important events what you're organizing and exclusively for you. In the meanwhile, let me briefly tell you what's happening in MMA so that the other people can log in a minute. We'll do that. Like on the 5th of August, that is on Thursday, we are doing a talk on opportunities for innovation and entrepreneurship by Revati Ashok. She's a startup evangelist and angel investor, one of the brilliant entrepreneurs. She'll be sharing her experience on the 5th. On Tuesday, the 10th, again, a very interesting topic, drone and the impact and security on businesses. We have a very brilliant panel led by Air Marshal Matheshan, especially in the field of drone, including the drone manufacturers, because we want to really balance it out between the policy implications as well as the security implications so that the businesses don't impact at the same time, the national security also not compromised. Then on Saturday, 15th of August, we have another interesting event, the role of alternate medicine, health and well-being. We have another brilliant doctor, Dr. Somya Swaminathan, Chief Scientist at WHO, will be joining us along with Rotarian Venkatesh. And also, this is a Giridhar Memorial Lecture. We are doing it in honor of Mr. Giridhar, who is one of our young members from MMA, who is no more with us, but brilliant young individual. Then on Thursday, the 19th of August, again, we have a conclave on dealing with China, strategic, political, and economic dimensions. We have again a very high-profile ambassadors, economists who will be discussing with us what's the way forward because our business is seriously impacted with the relationship what we have with China. This is happening at live at ITC Grand Hotel, but same time it will be a hybrid event which will be taken live all over the world. Then on 20th of August, again we have an interesting event, the CEO Factory, Read and Grow, and the management lessons from Hindustan Lever. Hindustan Lever is the one which really produces so many CEOs who work in so many industry and organizations. What makes the Hindustan Lever CEO to be so ready to be welcomed by all other industries? It's again a fantastic thing. You will learn what is the important criteria to be a CEO, and how you have to be most wanted person rather than a push factor, it will be pull factor which will be implicated to you. Then on Saturday, 21st August, again, we are celebrating the 382nd birthday of Madras. Now it's called Chennai. We have again a fantastic panel. We'll be discussing with about Madras and also talk to about the topic what you have chosen is Smart City Chennai. And 382 years, how we are going to become Smart City Chennai, and the Chennai Software Corporation Commissioner, the MD of also Smart City Corporation, and again a great Sheila Sheprakash, architect of renowned. There are a number of people who will be talking to us. On Monday, 23rd August, we have a conclave on Tamil Nadu CSR Summit, forging partnership and impact pathways. We strongly believe that CSR is one which really can impact so many people. From MMA itself, we do a lot of CSR activities for school children. And this is one we thought is an ideal time to do that because during the pandemic, the CSR fund should be judiciously used to really go and help as many people as possible. That's our idea. We are bringing some outstanding panelists to come and talk and also take a measure of what has happened in Tamil Nadu. For 24th, I have one more event so that the people are logging in. The dialogue on inner exploration, outer affect reality. We have Supriya Batmanabhan. Then on 25th 5th, we have a champion woman, the story of global adjustment, Ranjani Mani and Rogini Mani in conversation with Shankar. Then on 26th of August, another interesting event. What do you know? What do you want to know about doing business in Dubai? We have outstanding business people from Dubai joining us to discuss how you have to do business. So this is what is happening in nutshell next few days. Coming to today's event. In fact, when I spoke to Dr. Ravi the first time, introduced me one of my dear friend, Satyamurthy, who's also logged in. Immediately we logged in. Immediately I requested Dr. Ravi, let's do this program. It's really, really very important. Dr. Ravi was not only kind enough to join us to do this event, he also managed to get some outstanding people, doctors from around the world. I'm going to introduce them shortly. The topic is mental well-being, living in times of despair. Because we all know the pandemic's impact and we all go through, some of us got used to it. All the time you're worried about first, we're going to finish, then we had second, now we are going to be worrying about what's happening the third. We have an outstanding panelist, Dr. Ravi Samuel, in conversation with Dr. Esther, Dr. Balu and Naveen. Let me have the privilege of introducing the distinguished panelists for you this evening. As usual, if you have any questions, please share your question. The number which is flashed on your screen, all to the Zoom chat box, you can type your question. The panelists are willing to address all your questions relating to the subject which you are discussing today. Please restrict your question to subject so that we could take as many questions as possible. Let me have the privilege of introducing a distinguished panelist for this evening, Dr. Ravi Samuel. Dr. Ravi Samuel is consultant and psychotherapist, and Dr. Ravi Samuel is a psychotherapist trained in cognitive behavior therapy of National Hospital, Queen Square, London. And he is also published in national and international scientific journals. And we have shared the detailed profile of all the speakers today in the invitation. And just want to tell them some of the important points only we are telling. He has treated over 1,000 patients in 1991 on various issues connected with depression, anxiety, and much more. Apart from a clinical work, Dr. Ravi also enjoys conducting workshops, and he has trained so many people in Tamil Nadu police. I am fully aware of how much is impact on the police behavior in Tamil Nadu, and also counseling, assertiveness, professionalism in workplace, and much more. Very warm welcome to Dr. Ravi Samuel. Indeed, a privilege to have you with us. Thank you really for setting up the thing and facilitating some outstanding panelists for this evening.
Awesome.
Let me have the next distinguished panelist for this evening, Dr. Esther J. Ebenezer. Professor Esther is a professor in psychiatric and unit of Royal College of Medicine, Perak, and consultant psychiatrist and specialist and Pantai Hospital. And she also obtained a master in psychology medicine from the University of Malaysia. And she has started her memory clinic in University of Malay Medical Center in 2004. Dr. Esther is also a chairperson of Dementia Society, and she started the first Dementia Daycare Center in Perak State in 2012. She's also a ex-CEO member of number of Alzheimer's disease founder. And very warm welcome to Dr. Esther. It's a pleasure to have you with us this evening. Let me have the privilege of introducing our other distinguished panelist for this evening, Dr. Balu. Dr. Balu is a medical director and consultant psychiatrist from Central London, working both in National Health Services, United Kingdom, private patients. He has joined us this evening from UK, London, and voted as the best doctor of the year 2018 by the readers of Asian Voice in the United Kingdom. And he has developed an interest in organizational behavior and impact of emotions on decision-making and financial services industry. He has expertise in working with high achievers, people like type A personalities, helping them to achieve their full potential while minimizing the impact of their emotional problems and their work and family life, which is very, very important in the present day environment, and which is very relevant subject today. Dr. Balu is a member of the Royal College of Psychiatrists and also UK, American Psychiatrist Association, and also USA, and he's completed his MBA from University of Oxford. Dr. Balu, very warm welcome to you. It's indeed a privilege to have you with us this evening. Let me have the privilege of introducing Dr. Naveen Prasath Baskaran. Dr. Naveen is an internal medicine residency in 2001 from John Stronger Hospital of Cook Country, Chicago. He's also done his Bachelor of Medicine from our own city, Dr. NGR University, Chennai. And he's also done his Cleveland Clinic main campus, Hogio, Cleveland. And he's also delivered outpatient medical care in leprosy patient in 2015, worked in a secondary care hospital, outpatient and inpatient medical practice in the flood-affected village in early 2016. And it's indeed a privilege to have very, very high-profile panelists from around the world. We have one from Chennai, Malaysia, UK, and USA. and we are going to have an interesting event. Now I request Dr. Ravi Samuel to please take it forward, and we are eagerly looking forward to a very insightful evening this evening. Over to you, Dr. Ravi.
Thank you very much, Ms. Captain Vijay Kumar. This is indeed a very special evening in terms of mental health discussion. This narrative is going to change the mental health understanding and also the way people have been coping. I saw that this pandemic was either bringing the best or the worst out of the people. We are here to discuss how to bring the best out of you. First of all, I'd like to thank Mr. Satyamurthy for introducing me to Captain Vijay Kumar, who was very happy to organize this event. And the way it has been methodically organized is a learning experience as to how something should be organized. And a very big thank you to 3 eminent people who have joined us. When I asked, they simply said yes. I was very surprised because they are very busy people doing multiple things, but immediately they agreed to be here with us. So I thank Dr. Esther, Dr. Balu, and Dr. Naveen, because they bring a resource, an expertise that we are waiting to hear, because there is a lot we need to learn from other cultures. We need to know what are the problems that are happening in other cultures. I particularly very happy that Dr. Naveen joins us, because there are lots of post-COVID complications. There are a few patients who told me, I don't know why they saved me, doctor. They could have let me die. Why did they save me? So that is the effect of coronavirus on human beings. So we are going to hear from him the various complications one can go through and how one can prevent that. The focus is more on the prevention. The vaccination program is going on. Still, there are lots of people with massive apprehensions who are very scared to go ahead with the vaccination program. And also there is a counter narrative that's going on, which is against vaccination. So I expect Dr. Naveen to help us and remove probably all the fears that people may be having in their minds and enable the vaccination process. So I have been, over the last 2 years, ever since the coronavirus issue started, precisely March 2020, the mental health, the well-being, the coping of the families, individuals, couples have started having a huge impact. The kind of impact broke many families. Couples who were all the time together could not cope with each other, so they decided to go separate ways. On the other hand, there were families who bonded together and fought against all odds. Some families lost their livelihood. They lost their business. There was no income at all. It was either dependent on their savings or through support from family relatives. We are right now seated with a huge fear of a third wave, with a Delta variant, mortally scared. And there is a rumor going on, we don't know how far it is true, that it affects more the children, and the children are increasingly getting affected. So we are in a state of fear and panic. So let us discuss how to cope. If you are going to watch about corona news all the time, automatically the panic will be sustained. So what do we need to do to increase our mental well-being than putting ourselves in a vulnerable spot? There are people dying. There are relatives dying, loved ones dying. How do we cope with the grief? There is a process in it. Let us discuss about those processes. You may need to know what is the best thing you can do to yourself and to the person who is grieving. Earlier, people used to gather together and be in the house where there was a death. Now there is nothing like that. Sometimes we are not even able to see the body. Forget about congregating in the place. So let us talk about how we can be of support to others. If we are fortunate enough to have a livelihood, to have a flourishing business, even at the time where the whole country is suffering financial losses and business losses, let us see how we can be of support to others, not necessarily financially, but kind of emotionally, socially, just a call. I wished somebody a birthday. He made his day. He was so happy. He was so excited that I wished him. So a small act of kindness can go a long way in enhancing the lives of people. We may not reach out to large sections, but within our community, our maid, our servant, our gardener, our neighbor, like that, we can be of support to others. Restricted mobility can lead to stress and also anxiety and also panic attacks. And sometimes they go out unnecessarily and get punished by the police. So very important how we cope with the restrictions and cooperate with the state, because today, when I went out, I was shocked to see nobody wearing a mask. Everybody happily going and coming as though we have come out of the pandemic and we have returned to normalcy. Certainly it is not. I was mortally scared of seeing that. But people have their own understanding. Some people don't even believe that there is a huge problem. So how do we handle with restricted mobility? And my entire focus today is on the family. How do we get the best from the family? How do we stop the families from breaking down? How do we help the parents to cope with the children and children to cope with the parents? It is a very important issue. As we talk about mental well-being, mental health, safety is very, very important. Using a mask, using social distance, using a sanitizer, SMS, to remember. Because we have a false sense of confidence. I'm vaccinated. I don't think I'll be affected by corona. So let us fight against this false confidence. Sometimes we can endanger others. The Delta variant, as I understand, is more spread by those who are vaccinated because they are asymptomatic, but they give it to people who are not vaccinated. So we have to be conscious of the mental health, the physical health of others. And sometimes infection of corona could be a death sentence for many people, particularly if they are elders or if they have diabetes, lots of comorbid conditions like heart problems, diabetes, and things like that. Then we come to this area of fear, anxiety, depression. There are studies which says the corona can affect the cognition in the later stages. Probably Dr. Naveen can throw light on that. On the psychiatric side, we can also see psychosis because the stress factors are very high, adjustmental problems are very high, that can tip off those who are vulnerable and get them into a psychotic condition. So with all this, I'd like to open up the floor. I think Dr. Esther has got some slides to share with us. So I'll first invite Dr. Esther to give us some inputs about what she sees on a daily basis. Over to you, Dr. Esther.
Dr. Esther, can you unmute, please? Are you there online, Dr. Esther?
Dr. Esther, Right, she's not there. So we move to Dr. Balu. Dr. Balu, do you like to share briefly some thoughts about today's topic, and then we'll go on to other speakers, please.
I can see Dr. Esther coming back online, but
globally everyone is spared, and no country is spared from any. I will be talking a little bit on how the various population has been affected by the COVID virus, and the pandemic. Okay, so first of all, WHO is the World Health Organization. 2020, it has the declaration saying that public health emergency of international concern. This pandemic is a international concern emergent situation. So each country has its own problems, and particularly about mental health among different age group, it's a lot different. What I see in our people around the adolescents, children, the addiction to the social media is very a problem. They spend hours, they call as screen time 13 hours, 14 hours, 16 hours a day, they are in the screen time. So at the same time, the schools are online, so parents also cannot do anything about it. So they exchange their schoolwork, do their schoolwork all online. But at the same time, they also go into different lines, also with different social media contacts. So the actual time they spend in sleeping, spend time in doing some housework is very little. So they put on weight, and there are a lot of stress among the adolescent. Most of them, they came to me because they couldn't focus on studies. It is so distracting at home, that people around are making noise. So they each mom is also doing work, dad also doing work. The children also have to go on classes. So it is a very chaotic situation inside the house. So now we understand how were the good old days, when we go to school, we go to work, we focus more on our work in our either in the hospital or in the universities, and the children go to school in a very natural environment, and they play, they do physically active things, and they come back home and they do their homeworks. So now everything is online, homework, studies, everything. So the mental health issues has risen a lot among the adolescent, and the suicide rate also went up. There's more than 50% of the suicide in the last 2 years are adolescents in Malaysia. So among the young adults, I see a lot of depression, anxiety, and also there's the increased suicide rate among them. It's basically because a lot of them going through financial crisis. They have lost their job and they have no income, or some people get half-month salary, some none at all. Some businesses totally, they rely on the business, they can't open the shop, so it's totally gone, but they have to pay the rental. It's a big trouble, they are in great trouble. So they get depressed, they become anxious, and also like they're afraid of going out. Any little thing, they are so scared. They are all the time locked inside the house. Some people, maybe when Dr. Ravi was telling, you can see people in Chennai walking about without mask. That is too, they feel very free to walk, but many people with anxiety, they are afraid to get the sickness. They confine themselves into the house. They don't visit anyone. I had one patient, she was 65 years old lady. She was taking care of a 84 years old mom. She was a single lady, not married, and all the siblings are in different part of Ipoh and Malaysia. So she refused any of the siblings to enter into the house because she was so scared the siblings will bring the virus into the house. And she enjoys going out and having her fun with her friends, and her favorite place is Starbucks. Also, she never been for a long time. So all the food she gets from the Grab food. and end up she couldn't handle the mom, and the mom became very much bedridden, and she was emaciated. She couldn't. Elderly people, we should have a proper meal for them. We should take care of them in a different way, but she couldn't. So until to the extent she developed bed sore, the mom, then they brought to the hospital. I won't tell wrong with her because she was overtly anxious to come out of the house. She don't want to receive any help from this because of the fear of getting the virus from the siblings or from others. So the other children forcefully brought the mother out, and then she was hospitalized, and then she was in the ward for a while. We helped her with all the infection, everything. Then after discharge, we sent her back to the nursing home, not to her own house, because it was very difficult for the daughter to handle. Okay, so this different type of depression, they have also very often we see them coming with depression. This has been increased. A number of people are coming to the clinics. So I'm not sure how the experience in UK, I think should be around similar. Okay, how about the elderly age group? Elderly age group also, a lot of them, a lot of people coming with depressive symptoms, basically of loneliness. Even though the children live far away, they have group of friends. Every morning they get up, they usually go out in the morning, exercise. They have a bunch of people who do all the tai chi, they exercise. After they exercise, they go to the coffee shop, they will sit and chit chat until afternoon, then they come back home. They get themselves occupied, this sort of things. But since this lockdown, they are totally locked down inside the house, so they can't go out. Children also cannot come because from one state to another state to travel, they simply cannot travel. From one district to another district to travel, they simply cannot. So it is very difficult. They're left in loneliness, and they have lost all the friends around. So they become very much depressed, anxious. They couldn't do much more than that. And again, another sector is the people with dementia. Their dementia memory cognitions also, I've seen them worsening because they no more coming out and doing things. It's just locked inside the house, and they don't do any physical activities. The physical health also deteriorates. For elderly people, the common thing that we always tell, if you don't use it, you will lose it. Yeah, if you don't use your muscle strength, your physical strength, you will deteriorate very fast. So physically they deteriorate very fast. Similarly, if you don't use your brain, that also they deteriorate. So more so with people with dementia, because if they are demented already, their cognition is compromised a lot, and they are left to loneliness and locked down at home, and they have no other activities like cognitive stimulating activities. They deteriorate very much faster. So these are the impact that I see among the adolescent, young adult, and elderly groups in Malaysia. Maybe I just give us statistics. Our suicide rate, if you could see here, 2019, 2020, it has increased. But from 2020 to 2021, if you can compare, quite a drastic rise in the first half, less than half of the year, from January to May. Quite an increase in the death rate. Basically, they couldn't take it. Yeah, the most common suicides are very terrifying, like jumping from high-rise buildings, hanging themselves. So this is very common among the densely populated cities. Yeah, it's happening. It's very sad to see. Very often we do hear, on an average, from the police department, the statistic says a day, on an average, we have 4 suicides per day. And mostly 51% of them are young, adolescents. Okay, so with that, I thank you. I'm ready to take up any questions.
We will take questions a little later, Doctor. Dr. Balu, can you please take over and give us some brief about your thoughts on the pandemic and the well-being?
Sure. Thank you. Thank you, Dr. Ravi Samuel. And it's a pleasure to be here. And thank you for having me. Um, I'm just going to look a bit about how our experience has been here in the UK. Probably I'll not touch upon what is already publicly available because I guess you'll all be reading a lot about what's on the WHO website and different statistics that's coming out from different countries. But I thought I'll share a perspective as a medical professional and a management professional, and thanks to um, uh, uh, Air Marshal. I forgot his title.
Captain Vijay Kumar.
Vijay Kumar for bringing us medics into a management job. And if I reflect on my last 15 months as a medic, I would have thought that management skills of many other professionals helped us see some hope in this time of despair. And I will tell you a bit more about this in a minute. So when Corona struck, I was traveling. I'm used to traveling a lot. I was traveling, and there were lots of people with masks in Dubai airport, and people have had this issue in China. So we were from the West. People in Dubai were not really bothered too much with the mask. This was February 2020, and in March 2020, I was there for a wedding, and it was some family from Chennai in Dubai. And we didn't think much of this at that stage. And suddenly, things got out of hand, I must say. The Western world going to lockdown, scenes from Italy and London. And it was really a nightmare kind of scenario. And when you think about the situation then, we thought it would be a short, acute affair, where lots of people might get it and, we'll just get over it in 6 weeks, 8 weeks time, and we'll be back to normal, I guess. But now 16, 18 months later, we're still talking about it, and it has impacted several areas of the society. But thinking about the role of medical professionals, I must say that the medical professional was caught unawares, and we haven't had a clue by then as to what to do with it. People were presenting with non-specific symptoms, oxygen saturation dropping, and nobody had a clue. So obviously lockdown was the answer, and masks and sanitizers and all sorts of things was happening. And at that point, what was really needed was this act of getting people together to accomplish some goals. The goals being keeping people safe, and also using the available resources more efficiently and effectively, which I must say, doctors at that point haven't really thought about. We were running a health system, there was a waiting list for various things. There were acute care, emergencies, and the chronic care, and so on and so forth, rehabilitation. But this was completely new for anyone to manage. And this is where I think the management skills kicked in. Technology really helped to ramp up, sort of help, coming from all over the world. So this was still the situation in the Western world. And I think by that time, India hadn't really had a strong wave of Corona. What I saw then was very different to what I see now. We had people with what we call as COVID insomnia. People had COVID trauma. I had people who went into ICUs, came out, and they had nightmares and couldn't really get back to work. At that time, we didn't know a lot more about this post-COVID or long COVID syndrome. So it was a very different presentation. In fact, I remember talking to a young businessman, and we interviewed him on a video, and he had COVID complications. He had to go into ICU. He had kind of almost like a near-death experience, while he was in the ICU, and his perspective about life completely changed. So all of those things were scary stories. This was just before the vaccines came on. So once the vaccine started rolling out, people started to have a little bit more hope. But as Dr. Esther mentioned, all the other problems remained within the society, where people were losing their jobs, people had lost their loved ones, and they couldn't say proper farewells. and monetary loss was significant for many people who had lands or who had buildings that were rented out to businesses. Cafes were closed, entertainment centers were closed. So there was a huge impact. Luckily, the government stepped in to help with some financial aid, but still, it was much more than what the government can do in terms of financial support. So we went through all of that. But when vaccine came along, there was a bit of relief. But then there were challenges in terms of manufacturing them, distribution, administration. Again, we saw how management principles and technology was really helping deliver some good care to give hope to a lot of people. So the way I see it from a UK perspective is that we went through an acute phase. We had the vaccination program, which is relatively successful, and now we're coming out into a kind of a recovery phase very cautiously. So the travel restrictions are still in place, but officially the country is open. In my view, we may see more mental health problems coming out now because of, and I wouldn't see, in terms of increased pathology, but mostly about people coping with their losses and coming to terms with some of the challenges that they and their family has gone through. But because we are in a group like ours here, I would like to think that there is a lot of opportunities, and I would strongly bring a message of hope in this time of despair, because as the world, in my humble view, we've come together in spite of our differences to gather against this invisible enemy in some ways, and bringing in management principles and technology to helping each other. And again, like how we are connecting now and sharing knowledge is the way forward. So although our mental health is going to be impacted adversely during this time of despair, there's a lot of hope, and the humanity has come together to rise above the challenges that this corona has posed. And so I just wanted to bring that message, and I'm quite happy to go into any particular details anyone would want to hear about, but this has been my experience so far in the UK. Thank you for the opportunity.
Absolutely fabulous narrative, Dr. Balu. I strongly feel, yes, the management skills among the medical professionals brought the best out of them, particularly in terms of crisis management. The management is like playing a football, because the goalie, how much of goals he saves is not taken into account. Only the goals that he missed is kind of taken into account, and he will be bombarded. So like that, we don't know the figures of the medical professionals have saved. So thank you very much, Dr. Balu. We should talk more on management and medicine and psychiatry and mental health and well-being, because I'd like to bring technology into the whole spectrum of well-being. Now, over to a very interesting conversation with Dr. Naveen, who is a consultant in internal medicine, and he has seen the worst in the US, and probably all tied up for the Delta variant. We'd like to hear from you, Doctor.
Ellarkum vanakkam. It's a pleasure. I'll try to share the screen. I prepared a quick slide. So regarding the long-term complications of COVID, one thing I really want to emphasize is the psychological impact. We see generalized anxiety disorder, depression, especially the post-traumatic stress disorder is very common in the ICU patients. The patients who recover, they also have poor concentration abilities. They have impaired memory and significantly reduced quality of life, greater than 50% of reduction in the quality of life after they got discharged from the hospital. So what can we do regarding the psychiatric complications is the strong recommendation we do is grief counselors, because the psychiatric impact is not only on the patients, it's on the family members, the close ones, and also the healthcare workers too. For example, I train I completed my training this year. So we were in this pandemic. Over the past 1.5 years, as a healthcare worker, I see a lot of incidents of depression, anxiety among the healthcare workers itself. The reason is we are exposing ourselves. Our family is also on the risk of getting exposed to COVID. At the same time, the loved ones are also getting died in the ICU, prolonged ICU hospitalization. So the next step is grief counselors, online or in-person psychotherapist and tele-psychiatrist. In management perspective, I think the opportunity here is to have a good tool to coordinate these kind of psychiatric support to the general population and also to the healthcare workers. Um, these are the other things which we recommend. If you see in the role of medication is the last one. We recommend them to start with physical activity, exercise, psychotherapy, yoga, religious or spiritual practices, and the virtual support groups, and and the last one is the meditation and also the medications. Um, One thing I really want to emphasize here is who is responsible to take care of the patients and also the healthcare workers. The answer lies with the leadership and the management. For example, I work in University of Florida. Here, they have a wellness program for the employees first, and then also the patients. So they take care of their employees, I think, which is a very valid tool. I think there is a lot of opportunities in India where we can have those kind of online tools where they can provide online yoga, online religious or spiritual practices, and the virtual support groups. I think that's a good area to explore. And the neurological complications I really want to talk about is encephalopathy, which is the brain damage, which is very, very common with COVID infection, and also the tendency to develop a clot is also high. That's why they're developing stroke and they're having this disability. Usually, stroke happens in older population with risk factors, but unfortunately, with COVID, we are seeing a lot of stroke in young. Uh, uh, Many are the breadwinners for the family, and when they get immobilized, it really impacts the whole family. And as Dr. Ravi mentioned, we do really see a lot of cognitive impairment for patients with severe to critical COVID infection. So what are the things we do here? Uh, the skilled nursing facility. It's very common here, and what they do is the patients who got discharged from the hospital after prolonged hospitalization or prolonged ICU stay, we send them to the nursing facility where they help the patient to recover back at least they're able to do their activities of daily life, and then we send them to home. um, Other thing is the rehab centers. The rehab centers helps the patients to regain their strength. We call it as ICU myopathy. Patients who stay more than 1 month in ICU, since they're lying in the bed for a long time, they cannot even stand up or sit up after they recovered from the COVID itself. So we provide them physical therapy and also refer them to a physical therapy center where they work with the staffs to regain the strength before they go to home. Uh, Quickly, I just want to discuss about the respiratory failure. As you guys know, there is severe lung damage, even in young, healthy, non-smoker patients. And they also develop a condition called pulmonary fibrosis, which is scarring of the lung tissue, which is completely irreversible. Um, Again, for prevention, the best way is to yearly diagnosis and treatment of COVID, vaccination. It all plays a vital role. Um, as I said before, the clots are so common in COVID. They develop pulmonary embolism and also the deep vein thrombosis, the clot in the legs. And these are the other complications we see in COVID patients. This is the final slide. cardiac injury, kidney damage, and liver damage. One critical thing I just want to emphasize on this slide is the kidney damage. Patients with healthy kidney, they come to the hospital, they develop this kidney injury, and then they end up dialysis for life, which dialysis is kind of 3 times a week. And it's even though in the States it's a developed country, when I recently met a patient who's a teacher here, who's making a above the average salary. Still, they're not able to afford the monthly dialysis. It's here. It's really expensive, so the economical impact is also complicating the whole picture. Um, so, as Dr. Ravi asked me to mention about the prevention, I think the main recommendation is to get vaccinated. I think that we have enough evidence to support the vaccination. I know there is a lot of anxiety regarding the new, it's a new vaccine. How come they find a vaccine within a short duration? Whether there will be a long-term side effects. There are a lot of questions, but this is what I tell to my patients. When we give a medicine, even for a paracetamol, we have a benefit and also a side effect. When we compare the risk and benefits, I think the benefit outweighs the risk by 100 times in terms of preventing severe COVID infections. So I will end up by saying that prevention is the key. So please consider getting vaccinated. Thank you.
Wonderful. Thank you, Dr. Naveen, for that wonderful narration on the scenario of medical complications among the COVID-affected people. Let me bring forth an apprehension that people seem to share. There is a deep fear of thrombosis when they take vaccination, particularly after an actor, Mr. Vijay, expired following vaccination, and few other deaths. So people are associating vaccination with myocardial infarction and other cardiovascular, cerebrovascular incidents. Can you give us some insight into that, please?
Definitely. In regards to the vaccination, for example, with Johnson & Johnson, there is a risk of thrombosis. But I agree that there is a risk, but this is the way I approach it. What is the incidence? For example, how many people are getting vaccinated and how many people are getting the complications? That's how we look into. And the numbers are, it's not like in a threatening zone. It's like so much spaced out. So still there is a risk, but the benefit outweighs the risk. Actually, that's what I say. For example, if you vaccinate 1,000 people, it's actually like 1 lakh people, and then one develops a complication. But you have to see how many people got prevented by this long-term complications of COVID. COVID causes tendency in the body to clot. So it's a tough one. Whether it's due to COVID itself or due to vaccine, no clear-cut evidence, but there is a proven benefit to the vaccination, irrespective of the complications. Yes, the point is like the number of people who develop the complications are very less than the number of patients who benefit from the vaccine.
Wonderful. That's almost music to my ears, because that will encourage a lot of people who are listening to this, and the ones who will be watching the video of this will feel encouraged. Now, I'd like to ask a few questions and then move on to the audience participation. Dr. Balu, my question to you is, we are interested in knowing how the people in UK coped, or rather coping, it's present continuous, coping with the pandemic. What did you see as a unique feature in them? to give you a little scenario from India, there were neighbors taking care of COVID patients here, neighbors giving food, washing clothes, taking care of elders who were affected by COVID. There were volunteers who were risking their lives and taking care of COVID patients. So we saw a very beautiful sense of fellowship coming out of this. So something like that, I'd like to hear from Doctor.
Oh yeah. There were several examples. Thank you very much for bringing this up. This is a very important point. So when, as I say, we went through this acute phase when there was a lot of fear and confusion, and so we had people self-isolating at home, and there were several volunteers who were willing to help them with their shopping, dropping things off, and several restaurants, although at that point they were closed, they would open their kitchen and prepare food for frontline workers. And in fact, I was cooking with one of our Indian popular restaurants. I don't want to give the name, but most of the people would know the Chennai brand, coming into London. And I was cooking with them and leaving food outside for people to take away and stuff. So there was a great sense of community. And initially, people had this feeling that, we're all in this together. And, the sense that this is going to be very serious and we'll have to pull through this, so people did come together in a big way, and certainly frontline healthcare professionals, did all they could to help people, and particularly the UK government was very helpful in giving people some financial support as well. We call it as furlough schemes, and businesses were getting rebates on business rate, or discounts on some whatever taxes they have to pay. So it was very, very useful. And one of the things that I found very interesting happen was medical communities or psychologists coming together and setting up helplines, people giving up their time to take calls, because loneliness obviously was a huge issue. We had WhatsApp groups, all sorts of support coming through from different parts of the country and, in fact, in the world. And people within the UK were helped, and also people within the UK were able to help others. So yeah, there was lots and lots of things, and obviously the contribution of the army, trying to put up big hospitals that they had at that time, but now we didn't have any need for them. But people were really rallying together to help each other. So yeah, no, there's lots and lots of things happening, not to mention the religious organizations, churches and mosques and temples, gurudwaras, they were doing their bits as well. So yeah, so lots and lots of interesting things happening. Yeah, taxi driver, I can go on and on about different communities offering it in a different way. And all that I saw was, the human spirit and a lot of innovation. And the biggest sense of relief that we had was the regulatory bodies relaxing the regulatory rules so that real sense can prevail. I'm not saying that we don't need regulations, but sometimes we feel that there are unnecessary bureaucracy and regulations that get in the way of good clinical practice happening. And so dropping all of that, and yeah, those things were very useful, and in terms of, transformation of services within the system, that's a joke that goes around to say that, who was singly responsible for the digital transformation of big health systems, and including, our NHS, and it was Corona, not any CTO and not any CEO, but it's just Corona, fast-tracked so many of the digital projects, that were going through so many meetings after meetings and not getting anywhere. But, suddenly we had everyone going digital, So yeah, although, when you look at personal loss, I've lost many of my friends that I know, and there are people who are severely disabled. And in fact, coming to the topic of vaccination and thrombosis, I think I personally had experience of that. and I'm going through some of my own health challenges, but I see a lot of positive in all of these things. And I have, in my own capacity, decided that there has to be a slightly different way of practicing medicine, and how doctors, in fact, don't know much about prevention and nutrition and all of that, chronic disease management. So in fact, I have personally taken it upon me to take some time out of my career to explore this in great detail, because the management of what we call as post-COVID is going to be not coming, I must say, not coming from the medical world. It should be coming from more of a well-being, the alternative practitioners world, because it's really about allowing the body to develop immunity and heal, because this disease is still largely unknown. We have the vaccine to protect, but we need a lot more of collaborative working and learning from different areas to overcome this. So in many ways, I see this as a way of nature helping humanity reset, and we can only overcome this if we are all collaboratively working together. So in some ways, it has to be a forced collaboration, and we keep saying that no one is safe until all of us are safe. So we take personal responsibility for the welfare of the other, because the welfare of the other determines our own welfare. So I have a lot of positive learnings, from the corona. And in my view, that's the only way to build our way out of this very difficult and sort of despairing situation. Because as we know, and as Dr. Naveen very eloquently pointed out, medicines and ICUs are really bottom of the list. Humanity, collaboration, technology, management, and all of that will have to sort of come to the front to really lead humanity out of this very, very difficult scenario. However, and this is how I see it.
Beautiful, very comprehensive and very touching to hear. Even the taxi drivers were involved in care of
Absolutely.
corona patients.
Absolutely. And, sometimes I feel that, again, I come from more of a medical and management perspective. The lowest ranks of people within the medical establishment, the healthcare workers, the nurses, and, I by no means I say they are low, high in terms of hierarchy, but people who are not that well paid, people whose jobs were not that much celebrated, because the chief would have a different, I guess, level of respect within the system. But this was a great leveler. The professor of oncology was doing a shift, proning patients. Somebody, who's a head of research was just, administering some pills at the instruction of the head nurse. It was a great leveler. It was a great leveler. And we had the RV discipline come into how to ration things, how to manage things. It's very humbling. And as I say, a taxi driver shifting somebody from a community hub into a hospital without, worrying about the ambulance. Those things made the most difference. And even this is what is interesting for me. I know I was very distressed by some of the scenes I saw in the papers in Delhi. In India, we had a huge wave recently when hospitals ran out of oxygen and all of that. Very, very distressing scenes. We had similar things happening here, and how, again, same in India, how lots of people started doing all sorts of things they can do, not waiting for established protocols to kick in, because no established protocol was able to deal with this, And I think the corona is making us realize more about the hidden potentials of humanity. And it's our duty every day to be bringing those out, and being grateful for whatever we have, and practicing gratitude is important. And this was a great leveler. And I work in a place called Kensington and Chelsea, which attracts some of the most wealthy, accomplished people in the world, several billionaires and multimillionaires. But with Corona, it doesn't differentiate between anyone. Your billions didn't save you, and people were coming out to give out things, and it was so humbling, so humbling. And this is still happening, and I hope that it happens more. The only thing I sometimes feel a bit sad about is we had to have Corona to bring the humanity in all of us. But if that is how it is going to happen, so be it. Maybe it's a defense mechanism to think about, how do you cope with this despairing situation? But that's the only way out, I think.
Absolutely. Absolutely, Doctor. I'll get back to you.
Yeah,
Dr. Esther, will you be kind to tell us what sorts of problems were you seeing in your country? My assistants Gayatri and Kavya have collated some data which shows that the mortality rates were low in Malaysia. What was the scenario?
Actually, at the moment, currently our infection rate is going terribly high. Every day we have nearly 20,000 people for a small country of a population of 32 million. That is a huge number of positive cases and quite a number already in the ICU, and every day we are seeing deaths. And they have a system called My Sajatra, that means my history, where if you go to any places, you need to scan and go. Any hospitals or even a shop, a convenient shop you go, you need to scan first so that they can trace any contacts. Yeah, so that's how they are tracing. And I think our census is quite detailed census, and they are very up to date. Every day around 4 or 5 we will know how many new cases come in, how many deaths, death rate. So that is something we like. For example, today's I can show you. Today we had 15,000 new cases, 15 over 1,000. So like yesterday was 17,000. Okay, so today 219 passed away. 219. So on the whole, 9,403 passed away. It's about going to be 10,000 mortality people who died passed on. So the death rate is really coming up. It's not low, I would say. And our healthcare workers are really exhausted. They are burnt out. They are really, really burnt out. And that is the situation we are facing now. On top of it, there are political instability also going on, all going for power rather than looking into the pandemic issue. So many of the citizens are not happy with that. The politicians are very much sidelined. And again, there's a problem within the Ministry of Health, where many doctors from 2016 whoever completed their internship, they were not given a permanent job. They were given contract job. So by the way, if you are under contract job, you wouldn't have any facilities to go forward, that you can't go for a postgraduate training. So you are just stuck in the same place as medical officers. So they were not happy at all, and they went on strike. So a lot of things are happening. They were patient for years, for the last 2 years. Just the last just last month, July, they really couldn't see the Ministry of Health is not doing anything about it. They went on strike. Yeah, so they are facing a lot of problem in our country. It's not just the healthcare system, it is the political system also is affected. That is why it is a big challenge for us. And then at this moment, all the private hospitals are open to treat the patients with coronavirus infection, because previously private hospitals don't want to take in, but later the Ministry of Health sent a mandate that they have to take in a certain number of people with COVID, and our hospitals are really, really full. There's no beds. Many of the beds are being converted, like medical wards, surgical wards are converted into COVID ward. And even our clinics, many a times the patients don't come, because I'm a geriatric psychiatrist. Rather than they bring the old patients, the family will come and take medicines, or just they call and tell us how the person is getting on, and then they collect the medicine. And we have a system that hospital will send the medication by post. And also we have another system where people can collect their medication drive-through. There is a drive-through counter where they can just drive and they can collect their medications. So this sort of things. Actually, in the clinic, outpatient clinic, we see lesser number of patients that is coming for follow-up. But in private practice, I see quite a number of people are coming with anxiety, depression, like Dr. Naveen was telling, post-traumatic stress. Yeah, after going through COVID, in the initial part, the government was able to help with isolating people in a isolated place, like any assigned place, where many with the positive will be kept isolated. That was a real nightmare for people. And later, government couldn't cope. They are now advising us to quarantine at home. I think this is a better choice. Hopefully, we can sustain, and the cases are going on increasing. Our vaccination program is okay going on, but hasn't covered yet. It's about 60% also not yet covered. Yeah.
Thank you, Doctor. Thank you very much for those inputs. I think Dr. Naveen briefly shared about various neurological complications, cardiovascular complications. So I will leave the floor to Captain Vijay Kumar to take public questions.
Thank you, Dr. Ravi and Balu and Naveen and Dr. Esther. Very, very great insight. And we have over 1,050 people are watching this program live now. And I got a number of questions from social media and the chat box and Zoom. And we expect the people to, I think they have been so focused on your lecture. I think they will shortly type their questions. Let me now ask the question which has come on the YouTube first. Here is the first question from Mr. Arjun. Arjun is from Bhopal. What he wants to know, he says, I often experience a lower than usual interest in activities that I usually enjoy. How can I sort out these issues?
Dr. Balu, do you like to take that here, please?
I'm assuming that this gentleman has seen a change in behavior activity level during the corona. So it could be multiple reasons. If you are thinking from a sort of psychiatric point of view, when people get low mood, it does affect your level of motivation. When people are lonely, people are worried about their future, it's difficult to plan. So very commonly, low level of activity is associated with low mood. I mean, that's a very kind of a basic thing. But of course, there can be many other reasons why certain things can happen, having any neurological problems, any endocrine problems. I would say it is a very difficult time. So make sure that you are well hydrated, you have a routine. I know it is very difficult to do, particularly when you don't feel motivated. Patients ask me, how am I supposed to do this, that, and the other when I don't feel like doing it? The answer to that sometimes is when you start doing small things, you will start feeling slightly better and want to do more things. It is so easy to get into the state of inertia during this time. You only have to take small steps to build the momentum up. So no matter what happens, divide your day into sort of manageable chunks and do the bare minimum you can. And what you will find is once you start doing the bare minimum, one thing will lead on to another, and you can sort of move forward. Make sure that you also someone, stay in touch with family, friends, and try and avoid listening to difficult or challenging news, because we're not going to get any wiser by reading all these sensational negative news from around the world. So good hydration, healthy food, and sticking to a routine really helps.
Thank you very much.
Thank you, Dr. Balu. Brilliant. Stay away from all negativity. I think that's one of the principles we really put forth management. Be positive all the time. Here's again a question from this is a question from a student from a leading university, Mr. Francis. What he wants to know is, I am a student, and whenever I go to bed, I overthink about my future, and as a result, I don't sleep so easily. How can I combat this? Because I'm really, really getting depressed by this situation, what's happening to me.
Well, I'd like to answer that question because this is a very common problem among youngsters, and now nobody goes to sleep before 12 or 1 o'clock. There is something called sleep hygiene and sleep facilitating behavior. One has to prepare to sleep, not get activated in the mind. If they are watching something on the YouTube, or if they're actively playing some game, then they are activating the brain, and after switching off their phone, if they go and lie down, they are not going to sleep for next 2-3 hours. So it's a gradual, stepwise, progressive sequence of activities that facilitates sleep. So they may have to stop watching mobile by 8. They may have to have their dinner before 8:30, then read a book, listen to some music, have a pleasant conversation with people around, keep worrying out of the bed, because then they get conditioned. The moment they go to bed, they start worrying, because that's where they keep worrying about all the issues. If someone is worrying, they are activating the distress part of the brain, and they're not going to sleep. And after all, what we do in a worry is repeatedly thinking about the same problem without thinking of a solution. So avoid all these. Then there may be a question, what do I do with the problem? Well, there are better times to discuss about the problem or think about the problem. Think about the problem just once or twice, then start thinking about the solutions. One thing or other will work out.
Okay. Anybody would like to add, or shall we move to the next questions? Anybody? Okay, we'll move to the next question. Yes, doctor, I think we have been taught quite a bit in our management. Stay away from the amygdala. That's a gland which really puts you through. I think that's one area people should be careful about, the amygdala, which bring a lot of negativity into the people. It's a brilliant, Ravi, what you said, Dr. Ravi. I think people should really emulate and practice what you said. Avoiding late night movies, late night Netflix. So many movies coming. I think the other guys happily walking to the bank while our guys are suffering from sleep and going to the doctor and spend a lot of money. Brilliant.
Like the ATC who constantly advises the pilot, I think mental health professionals have to constantly advise people as to what they should be doing on an hourly basis.
Yes. I think here a question which is also related to what you just mentioned. Mr. Subramaniam from Chennai, you want to know, why do you think that we see so many suicides, teen suicides in the recent past, and how can we make sure that the teens don't indulge in it? Actually, what is the way to avoid suicides in the mind of the people who really get driven to this? How can we help them to come out of such a syndromes?
Dr. Esther, in your country, the prevalence of suicide is a little higher. So
Yeah.
you want to take that?
So it is a major problem. We do have helplines and some non-governmental organizations like Mercy Malaysia, where they can call and talk to them, and they have some programs and online chats, and quite a number of people they call usually when they are in distress. So apart from that, there are clinics and the connection, the hospital's connection, telephone numbers are there. So particularly they have set helpline for suicide, those people having suicidal intention. So that is happening. And also we see what is called copycat. So copycat suicide, like one started to have certain method, some violent method, then the series of violent method, similar method comes up. So this sort of thing shouldn't be publicized so much. This is very very delicate area about this issue, and now the government has realized it's a big issue, big problem. They have started with helpline, and also now educating, like some universities, they start to call people like us to advise on stress management. things like that. Yeah. So they can call the helpline 24 hours a day if they have any issues about suicide things.
I can add a few things. I think what Dr. Esther said was very important, and I'm getting several calls from young people who do experience suicidal thinking. The way I think about it is suicide a problem or a solution? Suicide is a problem for the society, for the family, for the teams, for the companies in some ways. But for the person who's going through whatever they're going through, they somehow see that as a solution because the other solutions that they see have not worked. So in many ways, the way I see it is suicide is precipitated by a distress and a limited problem solving capabilities and a perception of lack of support. So if you just leave suicide as an act to one side, we need to really think about how do you help people manage distress? How do you help people develop more coping strategies and also give them a good perception of support? So if you think about it from an employer's point of view, and all of those things are very essential. So you create a system where people can share distress in a confidential way if they're feeling distressed. You have workshops and seminars looking at problem solving capabilities, where people can share some of their distress and look at alternative ways of dealing with problems or seek different perspectives. And the employer can have support mechanisms in which would include psychological support, sometimes medical support, financial support, social support, and so on and so forth. So in many ways, for the people who are suffering, suicide is a solution. So when suicide is a solution, why wouldn't they opt for it? So as a society, as an employer, we see this as a problem, and hence we can put things in place to solve the problem. So it's about reframing the narrative around how we perceive suicide thinking.
Brilliant, Dr. Balu. I think a program like this really would add a lot of value. And here is the question that's addressed to Dr. Balu is from Uday Sate from Mumbai. He says, I do not have my family and friends support at all. How and when can I find a support system, and what is the way I can influence people to support me?
Okay, this is very, very interesting. Yeah. So people talk about love, right? People say, I can't find love. The best way to find love is to give love. The best way to find support is to give support. So, for example, yeah, I may not have the ability to do a multi-crore business or do many things, but I may have the ability to plant the seed. I may have the ability to just move one part. I may have the ability to influence just one person just by a small deed, a small word, and that will grow in strength. I'm fully aware that some people do live in very dire circumstances where people have let them down, or they may not offer them support they need, financially, medically, mentally, and so forth. But never lose hope. You only need to have that one seed of support that you sow for it to grow into a big tree. So always look inward. It doesn't matter if the other person doesn't support you or not. You approach them with gratitude, love, affection, and you will always get that multiplied, by you. Because you cannot put somebody through a difficult situation. You cannot put gun to somebody's head and say, hey, support me. That's not going to happen. You always say, can I give you a cup of water? Can I get you a cup of tea? Would you like something? And they would say whatever they need to say, So that is the best way to do it. Look inwards, it's all within you, and spread the word.
Brilliant, Dr.
At
Balu.
the same time, maybe I would like to add, sometimes you need to ask for help if you are in need of anything. You keep to yourself, you don't want to ask for help. There are help around. If you don't call, if you don't ask for help, the people might not come forward. They might not know in what need you are. So please don't feel shy, or don't, if you are in great help, please open your mouth, ask, it shall be given. So please ask for help. There are people to help you.
Very true, very true.
Brilliant, brilliant, doctor. Always seek support and also show empathy. I think people will be around you to help. Here's a question addressed to Dr. Naveen. This question comes from Pooja from Pondicherry. What she wants to know is, sir, who is responsible for the well-being? Is the management or the people? Are they to come together and look after themselves? And what did you see in USA in this situation? And she also wants to know how well the practice of yoga and meditation help people. I think a lot of people followed this in USA too. Is it true?
It's a very good question, and my specific interest is also on this area. I always hear how the system works in the university systems. For example, if you go and search wellness, University of Florida wellness, Stanford, Harvard, and all the pages, you can see the resources, the tools, and the way they can ask for help and get the things sorted out. So I think this is a big step in all the universities, organizations, and also government institutions should adapt this policy. They should have the tools readily available to the employees and also to the students. I think which that simple involvement, I think they can address a vast amount of population. I strongly believe that the initiative should be provided by the institutions and the government. And the contribution from the people is to participate and make useful of the resources. That's the participation. The second question regarding yoga and meditation. Here it's a big thing. I think in India, it's, I practice yoga. I have seen my personal benefits. And also here it's a big thing. In United States, for example, there are multiple meditation centers, and people take use of it. And I was surprised to see a lot of foreign nationals practicing and teaching meditation and yoga to the community around them. And it's in terms of business also, it's a good business model here. They are striving very well here, and they have huge campuses too. In Tennessee and other places, they have a huge campuses where they have in-house meditation centers too. It's a good way to start.
Great. Again, another question just now is come addressed to you, Dr. Naveen, and he says, Doctor, the meditation and breathing exercise, what impact has got on corona patients? And one few doctors advises is not advisable to resort to exercise related to breathing and meditation because it impacts your lungs. What's your view on this?
I totally agree with that point. So it's the COVID infection is kind of complicated. It involves different organs. I think before we do anything in terms of breathing practices, I think we should tailor it to the particular patient. For example, a patient with severe pulmonary fibrosis, I don't think they cannot undergo those kind of deep inhaling and exhaling techniques from the respiratory meditations. So I think it should be tailored. So that's why, as Dr. Balu said, it's a multifactorial approach. I believe in like a meditation, yoga combined with the allopathy medicine, kind of a multifactorial teamwork has to be done. So yeah, they need to consult a physician before they go to any respiratory kind of practices.
Thank you, Doctor. We have got a number of questions. I got a few more minutes. I'll try and squeeze in as many questions as possible. It is a question addressed to all. Any one of you can take this. Is a question come from Ravi Kumar from Nagpur again. Why are the psychiatric therapies so expensive? What are some of the alternatives available for people who can't afford such a therapies, especially when the treatment is prolonged for a long time? Is it psychiatric really expensive? Is it true?
Dr. Balu, do you like to answer?
This is a very, very important question in many clinical systems around the world. In terms of expenses, because it at the moment involves a lot of human contact, I guess, interventions by humans can be expensive in certain geographies. It depends on where you are. This is where I think digital solutions are coming in. Self-help is the best help. It's huge and it's the best help. You can avail group programs, going together to group programs, and this is where religion, spiritual experiences also help. Medicines still sadly are expensive, when it comes to chronic disease management, and hence I was mentioning to you about my interest in alternative medicine as well. What is very important to realize is, when it comes to mental health, you need to practice two simple things. Mainly think about self-care, having a routine. As Dr. Ravi Samuel rightly mentioned, sleep hygiene, it doesn't cost you much. Practice sleep hygiene. If you sleep well, half of your problems are easily solved. Nutrition and hydration is very important. Movement. When I mean movement, it could be a very structured exercise programs, yoga, for example, but even otherwise, going up the stairs, going for a walk before you have your meal, meditation, prayer, gratitude, gardening, having a pet. There are many, many, many things before you get to see a specialist. So it's really about looking at what is available around you and taking some proactive steps, helping each other, which can go a long way in reducing the cost of healthcare, which is increasing across the board. And now, in Corona, we're going to have more costs associated with it. Yeah? So all of that other things can definitely help. In fact, we have say that structured exercises, yoga is as effective as some of the medicines. And we also have to get away from the mindset that there is a pill for every ill. That's wrong, because we always want shortcut, quick solutions. Go to the pharmacy, go to the doctor, have the most expensive scan possible, have a drip. No, 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 no. You don't need any of those things. I have treated people with extremely complicated health problems, including severe mental health problems, with very basic, simple interventions over a period of time. So discipline, having a sense of community, talking to people, as Dr. Esther says, asking for support. There's lots of things available. It's a change of mindset that will reduction in the cost of healthcare going forward.
Yeah, doctor. I know many a time we go to the doctor, if he doesn't prescribe a
Yeah,
scan.
I would like to add here. I would like to add here, yeah. So I always tell I think in Malaysia we are fortunate. They have option of going to either private or government. Usually private, the services are different, fast, no need to waiting list is not that long. But we do have our government hospitals where they can see the specialist almost for nothing. Yeah, it's about 5 ringgit is very little money, who they can see as psychiatrist, and the medication for is also free, almost free. Yeah, so our healthcare system for mental health, if they can't go for a private practice, they always can go for the government side. We also encourage that, and always I will explain to my patients, it's not just giving tablet, as Dr. Balu is telling. It's not, swallowing tablet is so simple, so easy. If that is going to work, and we will become millionaires, it is not that way. Yeah, so it's just like diabetes. If you have a diabetes, it's not just swallowing the anti-diabetic is going to help you with diabetes. You have to control your diet. You have to go for exercise to burn your calories. Similarly, for mental health issues also, it's not just swallowing tablet. You have to go for regular exercise. Exercise is most important. Many times, mild patient depression, anxiety can get away without any medication, with regular exercise where the body can secrete its own serotonin and dopamine on regular basis. If you can exercise every day without fail for 2 weeks, the third week automatically your body will say, yes, you need to go for exercise. So this is psychologically you become dependent on exercise. So this is very important. That's why Dr. Ravi was trying to call me. I think so. I was doing my jogging because I waited in the university. It was late. Then I came, ran, and then I went for jogging. It is vital, very, very, very important exercise. Apart from that, mindset. As Dr. Balu was telling, a lot of potentials are within you. You don't know how to pick and use it. So that is one thing. And the negative thinking, they think everything in a negative way rather than looking into the positive aspects of things around. So I think swallowing medicine is very, very easy. Exercise also, to certain extent, we can help the patient to do exercise, but to have the positive mindset is they need a little help. Once they know they're on the right track, then it is easy for them. Yeah. So, and then the structured activities, that is also, I always used to give timetable for my patients. They sit and do nothing and nothing. Idle man's mind is devil's workshop. If they do nothing, all the devil will come and do the work, will have the workshop. So from morning until night, you go to bed, what are the things you have to do? Not necessary to follow 100%, at least about 70 to 80% you follow. That can solve a lot of issues. And you can, rather than the students, they procrastinate, sit and don't do. Towards the end, they started to prepare for the assignments, the research project. Then they come with a lot of anxiety symptoms. So we need to help them right from the beginning. Yeah.
Great, doctor. Be positive, exercise and exercise and exercise. And also another thing which came to light during the pandemic is that the government hospitals done extremely well in this part of the country, and we need to invest quite a bit in India, at least in in infrastructure, especially in medical terms. Here the question addressed to Dr. Balu again is this is from Sundar from Chennai. So the COVID patients, their kidney damage has become more prevalent and it's become common. What's proactive measures people should do who are got affected to make sure the kidney doesn't get affected? And you recommend what, based on your experience, advice to the people, especially when you get impacted by COVID, what measure you should really look at it to see that you don't land up in your damaging your kidneys?
Yeah, as Dr. Naveen mentioned, and as we all know, COVID is multi-system. It affects multi-system, so it is very difficult to isolate any particular organ system. But generally, prevention is better than cure, as we say. So again, using all those measures to prevent corona infection is best. But if you get it, again, it is very important to seek support much earlier. If you're specifically talking about kidney functions, you need to get things checked. That's key. You need to monitor kidney functions first, and foremost. Keep yourself well hydrated. Breathing and all of that is important. The mechanism of action is not very clearly understood, but some doctors believe that it could be related to the autoimmune response. It could be related to the clotting that we talked about. Increased risk of heart attacks. The same way. The vessels in the blood vessels in different parts of the body, including the kidneys, could be affected. So the main thing is get it checked. Visit a physician, get it checked, make yourself sort of safe, but also be well hydrated. Many of us probably may not drink enough water, so make sure that that's taken care of as well. And just stay safe, is what I would say. Nothing specific related to kidney functions though, but hydration is very important.
Here's a question addressed to Dr. Esther. Is Sankalesha from Jaipur. What he wants to know is dementia care is most expensive and time consuming. What simple tips you can recommend to avoid dementia from all age groups? It's not that age above 60 they really feel, but what is the simple steps you think that we can avoid dementia? Though you mentioned, keeping your mind engaged, keep exercising. Anything more than that you think what one should really follow in terms of diet, in terms of your positivity and more, doctor?
Okay, the answer is very simple. I think everyone knows what is good for the heart. If you know what is good for the heart, is good for the brain. I think everyone knows to have a healthy diet is very important for the heart. That is also good. Not to eat like the junk food and get all the problems related to junk food. And sedentary life is not good for heart. Same. If you're not doing anything, sitting in front of the TV, watching the dramas, I think now India is very famous for the dramas. And this is also happening in Malaysia, where they watch the Indian dramas. They sit and watch for hours. That is very, very unhealthy. So you make sure your weight is within the normal limit. Make sure if you have hypertension, diabetes, hypercholesterolemia, or cholesterol, it is well controlled. And better you do exercise to prevent the onset of diabetes, hypertension. If at all you have diabetes, hypertension, make sure you well control, because by controlling the what is called as a metabolic disorder, you can reduce the onset of vascular dementia, that is dementia due to vascular pathology, that means due to a mini stroke, small vessel disease of the brain. So we can reduce a substantial amount by having a healthy lifestyle. Again, human beings shouldn't be alone. They should be socially connected. So the connections should be either related to the church or related to the society. There are lots of things that's going on in the society. Probably now with the COVID infection, a lot we cannot move around, but a lot of things can be socially connected. That is very important. And keep your mind active. Read regularly. What the Japanese have found to be physically active, and do mathematics as much as possible, as fast as possible. It's not complicated maths. Maybe standard 1, standard 2 maths. Do very fast and read loud. Read loud. So reading loud, doing mathematics, exercising, controlling your diet, socially connected can reduce substantially can reduce the onset of dementia. Yeah.
Thank you. I think we got another 2-3 minutes. I will.
And one more thing, I think I just want to add on to the water, hydrated. One of my classmates, she's a geriatrician in US. She was telling in our group, when you pass urine, that is the signal your body needs water. So when you pass urine, immediately go and drink water. So you have to replace the water what is lost. So if you make it as a practice, whenever you pass urine, go and drink water, then you're really well hydrated, rather than keeping, I need to drink 1 liter of water, 2 liters of water a day. Okay.
Thank you, doctor. I'll take 2 last questions. If we got another 5 minutes, we'll try and squeeze in 2 last questions. Is it okay, Dr. Ravi? We'll do that. Yes. The one question is regulations. I think one of the speakers mentioned this is a question from Srinivasan from Chennai. Regulation is the lockdown. Is it essential? And many countries not really considering lockdown as a solution, because the livelihood and life has to carry on, and people have to learn to live with coronavirus. Is it true, sir? Dr. Ravi, you have to unmute yourself.
Dr. Naveen, can you please respond to that?
Yes. This is my point of view in terms of regulation. So United States was one of the countries which got hit early in the pandemic. For example, in the March 2020, we were treating the patients with upper respiratory tract infections. As usual, we do the initial test, it came back to negative. We remove the isolation and we go into the room without any mask. And then that's the time when we had the COVID, and we got exposed to the COVID on the first month when it came to the United States. Later, those patients turned out to be positive to COVID. So in terms of healthcare, I worked in the government system in India, in Tamil Nadu, in Kanchipuram district. Our healthcare system on the government side is comparatively good when compared to other states, but it's still not sufficient to have an epidemic or a pandemic like this. So they're working towards getting better. I can literally see that. I have friends. But in order to avoid that crisis, I think the main way is wearing the mask and prevention. For example, in the United States, they had the pandemic. To be honest, they also had the crisis, but they are the first one to get impacted, and they are the earlier ones to get resolved. For example, on July 14th, on the Independence Day, they removed the mask mandate throughout the country. And due to the new virus, now that it's coming back. But I think in order to avoid the crisis in the healthcare systems, I think it's necessary to be following the social distancing practices. At the same time, it's a risky situation that there is a financial compromise on the livelihood of many people. The businesses get affected. I think it's a very complicated area which the government policies should weigh in multiple factors. So if they mandate a mask mandate or a social distancing, I think I also support that.
One last question for the evening. We have a number of questions that come, but unfortunately, due to the paucity of time, we have got a question on music and relaxation. Can walking boost your mood? Exercise make you less anxious? Why mental well-being is critical time? So many things have come, but I want to keep this one last question to you. Is staying at home? This is a question from the Seth from Delhi. Staying at home, I start eating more food actually, and I've also become obese to some extent, and I feel all the time hungry at home. Especially when I keep sitting in front of my monitor and keep doing work. How do I avoid this situation, and how can I avoid eating food continuously? It's a problem. Don't look at
Dr.
the food.
Balu.
Don't buy the food at home.
It's a very common problem, and so I will share my personal experience. I know we are all supposed to be experts, but all human beings at the go. So I had a similar issue because I was working 12 hours, 14 hours, constant calls from around the world, and you can't even move, because it was a very distressing time. So over the last 4-6 weeks, I've got my own personal coach, and we were looking at this very carefully, and just being mindful. So first point is just being mindful of what goes into your mouth. Yeah, one. And two, one of the things he said was, every 30 minutes, just go for a walk around the house, even if you're not, having a garden, or if you can't go down, or if you're in an apartment, go 2 flights of stairs every 30 minutes. Build it into your workflow. Otherwise, what happens is you're consumed by whatever you're working at. It's stressful sometimes. There's a lot of data. If IT professionals, they're looking at all sorts of things, and you have the habit of sipping coffee. Next thing, it becomes a milkshake, and then some nuts, and then you order a burger. It just goes up and up. And you also have a tendency to comfort eat. When you're stressed, you really need some sugar, some comfort. It becomes a habit, and soon you become addicted to that habit as well. So to break that, have that breaks. Be mindful of what goes into your mouth, number one. Number two, break your work in 30-minute chunks and have 5-10-minute break. That would change a lot, and that did for me.
Thank you, Dr. Balu. Especially you must have had a tough time. You are working with one of the leading hotels in London, which are very, very popular in making food. I think you must have had a tough time managing. Excellent.
Yeah, exercise, you have to, I think I have seen quite a number of people when I went to university, some of the essential staff supposed to come, all of them put on weight, tremendously put on weight. That is something quite worrisome, really. But my strategy during this COVID, I said to myself, I'm not active as going out and running to one hospital to another hospital. I need only 2 meals. So I started taking just 2 meals. Nothing goes in between. So I was able to manage all this while I'm able to manage my weight plus my exercise. So initially it will be a bit difficult. If you feel hungry, go and drink water. Take more fruits, vegetable in between. That is not at all a problem. Fruits and vegetable, not a problem. It's just the sweet things is a problem. Don't sit in front of the computer a long time, because you tend to eat something and you do your work. Get out from the screen, walk around in the house, as Dr. Balu was telling. Do something physical. Maybe if you're at home, you can start doing a spring cleaning. You can start one room and one particular wardrobe, one particular shelf. Start doing a small portion first. Complete one room. Then you're physically active. Then once you complete one room, it looks really good. You'll get motivated to do more things. So don't be on the computer all the time, because all the handphones, the laptops, it is not good. And then one more thing I would like to tell, during this second wave, we are held up, I started to pick up piano. So I finished all the chords within 7 classes. I praise God for that. So it is really wonderful, something new I learned. I'm totally out. Our piano at home was lying down, not being used for years after my son left. So now I started using It's really, really wonderful. So learn something new skill. It's not too late to learn something new. Yeah,
Brilliant,
to keep
brilliant,
your
doctor.
rather from the screen, come out from the screen, do something else.
Brilliant. New skills. Before I go to deliver a formal word of thanks, maybe Dr. Ravi would like to have some closing remarks, or
I think there is a very positive message that we should go for vaccination. So all those who have not done that, I would encourage them to go for it. I was personally encouraged because we thought we'll have this meeting as a hybrid meeting. I will go to the MMA office and do it. So I took the vaccination, but we have finally done it as a Zoom call. The second aspect is mental well-being is very, very important. To add on to the answer why this man was eating excessively, probably is eating pleasure eating. Maybe he is not able to cope with the changes. So one has to look deeper into what are the adjustmental issues and come up with real life solutions. And the third is, of course, all the beautiful suggestions that the speaker said: drink a lot of water, exercise, keep reading, keep yourself socialized, and all the other suggestions that they gave. Thank you very much for this opportunity.
Thank you, Doctor. Indeed, great evening, great insights, thought-provoking insights. I'm quite sure the takeaway for the people have been fantastic. Thank you, Dr. Ravi, for facilitating this evening. Thank you, Dr. Balu, Naveen, and Esther. Really, thanks. You've been sharing your insights so beautifully. I'm quite sure a lot of our viewers watching this program, plus the program will be available in our YouTube and our website for next 2 years. A lot of people log in and watch this program as a token of our appreciation, since we're all separated by the pandemic and also different part of the world you are living. On your behalf, what you plan to do is present on behalf 400 face mask and also under mini sanitizer. I think till the vaccination done, this is what my team from MMA goes around the places. We also give them some sort of ration to the people who are in need, and we do vaccination program in collaboration with the government. These are small initiatives which we are able to help our neighborhood places, educate them why the mask wearing is so important. We've been doing that. Thank you so much for each one of you for sparing your valuable time this evening, joining us from different part of the world. I know the time zone is different, and especially Naveen, you have to get up early in the morning to prepare yourself. Dr. Balu, again, it's fantastic you joined us from London, and look forward to seeing you when you visit next time Chennai. And Esther, thank you. Now we understood, Doctor, we were trying to get through to you why you're not joining. I think you're really doing jogging. That's the reason you're not joining. That's a really interesting thing to know, that it really kindles our thought process that we must really take care of our health. As usual, Dr. Ravi, fantastic evening. Thanks so much. Thanks to each one of you. Thank you all the viewers watch this program live, more than 1,000 people watching. Thanks. Your encouragement is around, which is pushing us to bring you some outstanding programs for you. And I'm quite sure you would have immensely benefit as much as we all benefited from the thought-provoking insights shared by the distinguished speakers and panelists this evening. Thank you. Stay safe, stay healthy. Till we meet again. Bye-bye.
Thank you for having us. Thank you.
Thank you. Thank you all.
Thank you. Thank you.
So thank you very much, Dr. Esther, Dr. Balu, and Dr. Naveen. I really, really appreciate this. Thank you so much.
Okay. Thank you, Ravi, for having us. It was a wonderful talk.
Thank you, Doctor. Thank you very much. And we should appreciate Dr. Vijay Kumar for his impeccable organization.
Dr. Balu, where are you practicing?
I'm in London.
In central London.
Yeah.
All right. Okay. My classmate, she's Ilamadi, she's in Oxford.
Okay.
Okay, right. She's a GP there. Okay.